Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. The Menzies School of Health Research is celebrating its 40th anniversary. It's Australia's leading medical research institute for improving health outcomes for First Nations people, and its reach now extends beyond our shores to the Asia-Pacific region. To commemorate this milestone, Menzies has chosen a collection of papers published in the MJA to highlight their research. Professor Alan Cass, AO, is the Director of Menzies and joins me now to discuss its work, its history and its future. So first of all, what does turning 40 mean for Menzies?
The idea was to have a centre of research excellence and excellence in health education as well in the Territory to address the critical health problems of Northern and Central Australia and the region. Menzies has fulfilled that role for 40 years and is in, of and for the Territory in Northern and Central Australia. And I think that direct relevance to addressing those critical health issues over 40 years talks to what we try to achieve and the impact that Menzies has had over that time. Menzies has a 40-year track record of having its primary focus on those fundamental health issues and working in partnership with community to address them. And I think that's what turning 40 means, that we know what our focus is and what we want to achieve, and we'll seek to continue doing that for the next 40 years.
Looking back over the past 40 years, why has Menzies' work been so important?
I think the place of Menzies, being here in Darwin and in and of Northern and Central Australia, is critical. And Menzies has always had that fundamental focus on work to address Aboriginal health and well-being and the critical health issues identified in partnership with communities across the region. So I think it's been important because we focus on genuine partnership with communities, health services and government. We've shifted, we want to attract and retain absolute experts in areas of health, medicine, etc. to do work, but that very clear focus on genuine partnership means that we have explored the issues that matter and that will have the greatest impact, we hope, on the health and well-being of communities.
What achievement or achievements are you most proud of?
I think when you look back over, for example, the papers that are included in this collection, the work even from, almost 40 years ago is so incredibly relevant still today. We have done work that has had very clear impact. I think often early in terms of recognition of critical things like the social and environmental and economic determinants of health. Menzies, through partnership, has been addressing them. A way of working with people living with health conditions, their families, communities and health providers to co-produce what are the questions we need to address, how do we address them, and how do we tell the story of the impact of the research has been an ongoing core theme of our work. And I think I'm quietly proud of that deep partnership with health services, hospitals and communities, and that we are accountable, that we will listen to our partners if they say we need to be doing things in a particular way, and we will seek to do practical work that will have results.
And what are the highlights of this collection?
So this collection includes 10 articles over four decades of work. It shows, I think, the breadth and depth of the research to address Aboriginal and Torres Strait Islander health and well-being and to address critical global health issues. The highlights of this collection, then I think are papers that address very early in terms of sort of awareness and focus, social and environmental determinants of health, public health, nutrition, key aspects of community approaches and understanding and factors that will shape diet and health, partnerships with health services to understand how people access care, to clearly outline inequities in access to essential treatments, and to think about solutions that will address those critical issues of inequity for people of Northern and Central Australia.
And just to add to that, why did you select these 10 articles and what makes them significant?
One of the things that I love about the research at Menzies is that, we're not an ivory tower institution. The aim and focus of the work is shaped together by people living with certain health conditions, by their communities, by community-controlled health services and people working at the front in delivering health services. And I think you can see that in these 10 articles that we have chosen across that 40-year period. They have been early examples of people identifying emerging problems, sitting down with communities and health services, and then intervening in a way and trying to evaluate the impact to improve health. And I think that tells a powerful story.
Talk to us about the 4 MJA articles that are the best of their publication year and what it means to Menzies.
So I was having a look at that today. So I think the MJA has had that award 28 times, and indeed 4 of those have been 4 papers written by Menzies researchers and collaborators. The first one focused on the emerging problem of kidney disease and chronic disease, particularly on the Tiwi Islands, which was shown, decades ago to be, unfortunately, a community of Aboriginal people living with a devastating burden of kidney disease. And what this paper did, researchers and clinicians working closely with the community showed very clearly through population surveys and follow-up the devastating burden of illness, but then together designed an intervention working in community to try to have impact on that. So that one was a very early example of a community-based program seeking to prevent the development and progression of kidney and chronic disease. Incredibly important. The second one was one that I was lucky to be involved in, where I came to Menzies to do my own PhD, but also to work as a kidney specialist at the hospital. And this one focused on the devastating consequences of miscommunication in the cross-cultural setting, where we filmed critical interactions between doctors, nurses and educators and Aboriginal patients who usually in the Territory will speak several Aboriginal languages, and sometimes English may not be their first language, and where I think it was a very early and critical piece of research showing the extent of the miscommunication, that it was often not perceived by the clinicians caring for people, and the devastating consequences that it had for people living with chronic illness and in this case with kidney disease. That paper has become a critical teaching tool for health students and has led to an ongoing over 20-year program of work to address issues of cross-cultural communication and provide better training for health professionals in this area. The third paper was from a program of very high-quality practical clinical trials to address otitis media. Only 10% of Aboriginal children in remote communities unfortunately still have both ears with perfectly normal hearing. Otitis media, middle ear infection, is incredibly common still today amongst young Aboriginal children in communities. This was, again, a practical trial done rigorously and highest quality, looking at could there be a simpler method of treating of recurrent middle ear infection leading to better health outcome. And the fourth one, I think, builds on the work in Aboriginal health in the Northern Territory addressing rheumatic heart disease, but is an example of taking our work to the global health setting. We're a close partnership between doctors at Royal Darwin Hospital with Menzies School of Health Research, and that is a common theme throughout the 10 papers in our 40 years of work, did a beautiful study in Timor-Leste where they looked at the community prevalence of rheumatic heart disease amongst school-aged children there, and those shared health challenges for people in our countries, our neighbours to the near north, and bringing those understandings and ways of doing research in partnership. That's a beautiful example of that, the fourth of those award-winning papers.
So how has Menzies' work evolved over the past 4 decades?
The world's changed massively over the past 4 decades, hasn't it?
Yeah.
There has been a change across the whole health sector from one of perhaps researcher curiosity and investigator or expert-driven research to research that needs to be undertaken, as I said, in genuine partnership. And Menzies' research has changed in that way over those 4 decades. I think deep ongoing partnership, as I said, with people who live with health conditions, with their families, with community-controlled health services, with doctors, nurses, and other health workers in hospital and community settings. This is critical so that you ask the right question, you use the right methods, you focus throughout on how you translate knowledge for the benefit of community. And I think we have a very explicit focus now. Again, I think Menzies has thought this is important throughout its 40 years, but there is a very explicit focus now on knowledge translation, on how we ensure that the knowledge generated in partnership is fed back in the right way to participants, their families and community, and how we engage with health services and policymakers to try to ensure that findings then inform new policies and new developments in health service delivery.
So why did you come to Menzies?
I came to Menzies first in 1998. I trained as a kidney specialist in Sydney, and we would fly out to Western New South Wales, to Bourke, Boron and Dubbo and places to run clinics at the time. And it was obvious to me that in those settings that nearly all of the people with significant kidney disease needing care were Aboriginal people. And I wondered, I thought, why is it that there is such a burden of kidney disease affecting First Nations Australians? I knew I wanted to do a PhD. I knew I didn't want to do it in a lab at the time. And I wanted to explore some of those issues, and I couldn't find people at the time in Sydney to work with. And one afternoon going home, there was a letter, times when we received letters, not emails, in the post box saying there was an opportunity to do a PhD exploring the antecedents of kidney disease in Aboriginal communities at Menzies School of Health Research. I opened that letter, went in and said to my wife, I think we might need to move to Darwin. She said at the time she thought that was ridiculous, but we flew up and explored the options, were welcomed. And I think I realised through that, we lived here for the next 4 years, that there were such important challenges to be addressed where I had some skills as a kidney specialist and an interest and passion to understand what were the factors that drove the heavy burden of disease, how could we improve service delivery to meet people's needs. And I felt that was a way that I could have an impact and benefit people.
That's a big move from Sydney to Darwin.
It is. Darwin and the Territory is a remarkable place to work. I think another thing I love about working at Menzies is people are here who are passionate and committed to their work. I think are not generally about doing it for their own sake, but because they think that here is a place where it's critical to address fundamentally important health challenges, and where you can do things that are potentially of real benefit to patients, to communities, and health services addressing really challenging health problems in Australia.
And with its deep connection to healthcare systems and services, how does Menzies' approach stand apart from others?
I'm biased. I'm the Director of Menzies, so I obviously love it and have passion working here. The best researchers working here are clinician researchers. And when I say that in the broadest term for clinicians. They are doctors, nurses, psychologists, nutritionists, microbiologists who've worked in hospital settings. So these are people who combine a deep understanding as a clinician or health professional working in the system with their passion to do research to address those issues that they see when they're a doctor or nurse, seeing people coming in with strange patterns of infectious disease that they need to treat and try and get the best outcomes, and that they then bring that passion and understanding to their research to try to understand the causes of illness, how to better treat people and get better outcomes.
So how does Menzies engage with the broader global research and health community?
Menzies has, over more than 30 years, had ongoing partnerships with health services, governments and communities in Malaysia, Indonesia, Timor, and a very important footprint working with collaborators across more than 20 countries to address critical issues around malaria, an incredibly important health issue impacting millions and millions of people across the Asian region and causing both devastating health consequences, morbidity and mortality. And we have a remarkable program of clinical trials, partnership with health services, working in some of the most difficult settings, but addressing that critical health problem in partnership and shaping government and WHO responses. So there's both areas of deep expertise, but the other example, I think, is we have worked in Timor-Leste in partnership for a long period. And over the last 6 to 7 years, Menzies has built an office with close to 100 staff and worked very proactively in partnership with the Ministry of Health and Agriculture and Fisheries to address fundamentally important health issues in partnership with the government, health services and communities in Timor-Leste.
And what's next for Menzies? Where do you see the organisation heading in the years to come?
In some ways, that partnership with communities, health service and governments is critical. We need to continue to be responsive to emerging and priority issues and be seen as a trusted partner in Northern Central Australia and the region to address them. We have an emerging important program exploring issues around climate change and its impact on health. This is so critical for people in remote settings in Australia, remote communities and across the region. I am keen to support the ongoing development of that program and to really explore critical issues for community members, that some of which are about attendance and health, what health needs, but there also addresses issues of housing and a whole array of environmental determinants of health. I think we're uniquely placed in the territory. It's a small jurisdiction addressing fundamentally important health challenges. There is an opportunity for us to partner in a very meaningful way with health services and systems so that we can make real some of the things we talk about across the country. Learning health systems. How can we work together to use data generated in health systems to drive quality improvement, to see emerging health issues and safety and quality issues and address them? What are the further opportunities for partnership with the Department of Health to really strengthen our ability to attract, retain the best staff, to ask the right questions, do things in partnership and have an impact? So I think how we make real some of those issues about learning health systems and a system that is able to use its own information, build capability of its own players to have an impact is crucial. I would like to also see us really focus our message on the work we are doing and its relevance to closing the gap. Nationally, there is so much that still needs to be done in terms of closing the gap on life expectancy, addressing the growing burden of complex chronic illnesses. And I think here the needs are pressing, and those place-based partnerships with Menzies hopefully being a trusted partner to have real impact in that space, it will be a very clear focus moving forward.
Thank you to my special guest, Professor Alan Cass. You can find more podcasts on our website at mja.com.au or wherever you find your podcasts. Thank you so much for listening.